Hello, today is Tuesday, April 14th, and I'm proud to say that I have two of our real heroes with me at Silver Cross. We're going to take off our masks for the purpose of the video, and of course, we are a good 6 feet apart. Let me introduce Sandy Stanek, who is a nurse on 6'4", and Caroline Hinkle, who is a certified nurse assistant, also on 6'4". 6'4" was the first unit that we admitted patients with COVID-19 to, and Sandy was just telling me that she was the first to care for a COVID-19 patient. Yeah. Before I ask you any questions, I want you both to know from the bottom of my heart and the entire team's heart here how grateful we are for everything that you're doing to care for these very, very sick patients. You're just amazing. So Sandy, you had the first experience. Tell us a little bit about what that was like.
Yeah, so me and Cheryl Stover and one of our CNAs we were given the very first patient. There was two nurses that were kind of handed us off this patient that was up there for a couple hours. They said, okay, there's your patient. It was kind of surreal to think that we were in this unit. It was very quiet, and we just had this one patient. And then throughout the day, we kind of, Cheryl took turns going into the room and taking care of the patient. And then as the day went on, we started getting more and more and more. And by the time we left at 7:30, we had 5 patients that day.
Oh my goodness. My goodness. And of course, now we're managing patients on 4 units and in the ICU and other rooms in the hospital. So Sandy, how long have you been at Silver Cross?
So I've been at Silver Cross for 4 years, as long as I've been a nurse.
Oh, fantastic. And how about you, Caroline? How long have you been here? And
Just under a year. And I've been a CNA for about 3 years now.
Oh my goodness. Well, we're very lucky that you both choose to be with us here. So throughout your careers, you've never seen anything like this. I know. So how is care different? How do you take care of patients, Sandy?
Well, what's different is all of us, we're not in the rooms as long as we would like to be, giving the quality care that we're used to, because we don't want to be in the rooms too long to be exposed. We're doing our shift reporting on the outside of the room when we usually do it on the inside of the room.
At the bedside, right.
So after shift reporting, we're calling our patients on the phone, making sure that they're okay and if they need anything right away. Most of the time they don't, and we tell them that we're going to be in as soon as we can. We try to cluster our work together. I know we work with the CNAs. If we have to do any blood pressures or taking the vitals, we'll do that because we're going in the room anyway. Right. So we'll do that. And we try to get in there just before our meds are due so that we can do our assessment and then give the first set of meds. And then we can go on to our next patients.
Okay. So a lot of your flow and your processes have changed throughout this. And you mentioned protective equipment, and I'm wondering if you two can show us what you go through every day in terms of putting on PPE.
Sure.
Do you want to take a look at that?
So Caroline's going to demonstrate how we start our PPE. So first she's going to wash pretending like she's putting some hand sanitizer on, and then she's going to put on her first set of gloves. And then after that, she's going to put on her N95 mask. And then we put on another mask over that so that we protect that mask, because that mask, we're going to be wearing that mask all day and we want to keep it very protected. Then the outer mask will be discarded. Then she will put on the gown. And face shield. And a second pair of gloves. So you can see how it could take some time to get everything on, especially if a patient needs us right away. It can sometimes be hard. We do have cameras on the in the insides of some of our rooms, and monitors on the outside for patients that have dementia or any other altered mental status, that we have to keep an eye on them so that we can see that they're starting to get out of the bed. We can hurry up and start getting that on before they're actually out of the bed. So it's a little challenging, but we actually have been doing very well with that.
Good. Oh my goodness, that takes a long time. There you are. And I know it reassures everybody how safe you are and how you're keeping others safe. But then you have to go through a whole process on taking things off as well, right?
So how does that work? The first thing that we're doing is we take off that inner mask, and that gets discarded in the isolation bin. Then the gown, and as she's taking the gown off, you take the gloves, first set of gloves off at the same time. And that goes in the isolation bin. Then you can, a lot of the nurses are using hand sanitizer on the gloves, the remaining gloves, leaving the room. And when you leave the room, you can then take off your mask and clean it with an alcohol wipe.
Okay.
Take off the N95 mask. That goes in a bag for us to use later. And then we discard our gloves.
Wow, that is a big process, but clearly you have it down. And Caroline, do you feel protected?
Absolutely, yeah.
Okay.
I feel like once you're geared up and everything, going in the room, you feel much better being able to take care of your patient. Just because then you know that you yourself are protected, so you can just go in and do what you need to do to help them.
Thank you for demoing that. And I think it's important that everybody knows what you go through before you go in and out of a room. So speaking of that, what about if somebody has a loved one on the floor? Can they visit them? How do they communicate?
So the family really can't visit. It's really for their protection. But we're doing the best we can with making sure that we speak with the family members throughout the day. Many times they're calling us, or we'll call them to update them, but they're still going to keep calling us because they don't know what's going on. And it's a little difficult. We might have some a husband or a wife or some daughter or a son calling us 4 or 5 times throughout the day, but we just do it.
Yeah, because people are scared.
They really are.
People are really
And we've
scared.
actually been able to, a lot of the family members have their own cell phones in the room, so we're able to set them up with FaceTime with their family, or we'll go in and give them the phone. We'll call their family member for them and put the phone up to their ear. So that's working out. I know it's not the same, but it's the best that we can do right now.
Sure, but I'm sure everyone appreciates hearing from you on a regular basis. So we built this thing called an ante-room before you come into your unit, and it's a protective shield, really, made of plastic and whatever that separates the unit from the hallway. Why did we do that, Caroline?
It's basically an isolation to protect us from any of those particles or any of that air to get out. So it's a small room that we walk into. You have to make sure you close the door behind you whenever you go in, and then open the next door prior to entering the unit. From the neutral room, basically, to the air that could be potentially more infected. So it just reduces that risk of anything transferring out from the unit.
Okay, good. And we've heard a lot about how your unit is negative pressure. What does that mean?
Well, that's a ventilation system that pulls away the contaminants and exhausts it to the outside. So it keeps us from being exposed to any of the smaller particles that could be lingering in the air.
Okay, good. Good to know every protection's in place. So what about your families? Talk a little bit about your family and how they're feeling. Caroline, who do you live with? And
I live with my boyfriend and his family. We a little nervous at first, on their side, just hearing about the fact that I was going to be working on a unit that would be COVID. But after learning more about it and understanding, what precautions can I do before going home, kind of helped ease a little bit of that.
Sure.
So just making sure that, they're all safe. And, whenever we first started working on the unit, I told them what I would be doing. And they said, we appreciate you just going out there and, you're helping people. And so that's, what's most important. But of course, taking precautions at home and everything. Yeah. We have a bottle of hand sanitizer set outside the house before going in.
Good.
And when I get home, I always throw my laundry right in the wash right away. But of course, the hospital is providing scrubs, so I can change when I get here. So that way I'm not taking anything home. Okay,
good. Well, please thank your family for being so supportive. And how about you, Sandy?
Yeah, it's pretty much the same thing. When I get home, my shoes, my coat stay in the garage. I use hand sanitizer. There's a bathroom right when you come in, so I go right in there. Clothes go in a bag, take a shower, then it goes down into the laundry. The bag goes in the garbage, and we're all kind of keeping away. So I'm about 6 feet away, and my poor husband's sleeping in a spare bedroom. He's very nice to do that for me. He let me keep our room. But,
well, please thank him and your family as well for being so supportive of you during this. So overall, how's the morale of the staff on the 6th floor?
Well, I think the staff is amazing. Ever since I've worked here at Silver Cross, I have been amazed at how very supportive and willing to help everyone is. And I think during this crisis, that support has definitely escalated. And I think I can speak for everyone when I say that if we could not get through this if it wasn't for the amazing and dedicated teamwork from everyone that is up there working on this unit. And I'm so proud to work with everybody.
That's so nice. That's nice. And Caroline, would you want to add anything to that? How you're feeling?
I completely agree. I feel like the teamwork on our unit is so strong and everyone is supportive, especially if you know you are going into a patient's room and you need something. You press that call light, people are answering right away.
Fantastic.
You know, I feel like you can really feel the camaraderie of everyone on the unit. So it just makes for whenever you know you're going into something where it can be stressful and it's scary, that you have that support behind you and that you can come in strong and help the patients.
So what can we do to help you? What from the community? Community asks all the time. What would you?
I feel like they're doing it already. I mean, from our managers, the doctors, I can't believe how supportive that everybody is. How we're all working together. And I've loved twice now, I've been able to witness the wonderful car parades that come by when we're leaving our work, the balloons and the kids screaming out, thank you, and the posters. It's been really comforting. And of course the food. We love the food that we're getting up on the units. We really like that.
Good. Anything else to add, Caroline?
I also saw the parades and I just thought that they were just so lovely, and just the love and support from the community, getting notes and appreciation from people just really makes you feel like you're doing something.
Oh, that's I'm so glad you feel that, because not only does the community love you, I love you. Everybody here at Silver Cross loves you, and I wish I could give you a hug because you know I'm a hugger, but thank you from the bottom of our hearts for what you're doing to keep patients safe and helping them recover. Thank you.
Thank you.